In our body, we have contractile and non-contractile tissues. So while come to contractile tissues, we have muscles and tendons. These tissues have the property of actively contract and relax and generate force and driving movement. So examples are muscles and tendons. So non-contractile tissues, these tissues don't have the capacity or capability to actively contract and relax like the contractile tissues. So some of the examples are capsule, ligament, bursa, fascia and nerve roots. In contractile tissues, both the active and passive range of motions are restricted in opposite direction. For example, if the biceps muscle or the bicipital tendon is injured, so biceps muscle do elbow flexion. So if we do opposite direction movement, that is the elbow extension, so it will be restricted and will maybe painful also. So in case of non-contractile tissues, the active and passive range of motions are restricted in the same direction. Passive joint play is normal in case of contractile tissue lesions and it is painful and restricted in case of non-contractile tissue lesions. Why the passive movement is normal in case of contractile and it is painful and restricted in case of non-contractile? Because let's discuss with an example. So in the previous example, biceps. So biceps, we all know that it does elbow flexion. So if the therapist or someone else do elbow flexion, the biceps muscle or the bicep tendon, we are not putting any weight or force on the biceps tendon. It is the biceps or the biceps tendon is in a relaxed state. In passive movement, the patient is not doing anything. The elbow flexion movement is done by the therapist or someone else. So biceps is not in a working state. So it is in a relaxed state. If we do passive movement, then we will not feel any restriction or the patient will not feel any pain, because in passive movement, the muscle or the tendon will not in a working state. But in case of non-contractile tissue lesions, if we do passive movement, then also the capsule, ligament, bursa and nerve roots are working. So we will feel painful and restriction in case of passive movement, also in case of non-contractile tissue lesions. So in case of contractile tissue lesions, the resistive movement will be painful, and in case of non-contractile tissue lesions, it will be symptom free. So why resistive movement will be painful? Because as I said earlier, in case of bicep, if we put resistance in elbow flexion movement, so we will be putting extra load on the biceps muscle or the biceps tendon, so it will create pain if the biceps muscle or the biceps tendon have any lesions. But in case of non-contractile tissue lesions, if we put resistance or in resistive movements, it will be symptom free.